So for this bit of Oral Hygiene 101, I'm gonna talk about flossing. So the proper amount of floss is 18 inches. That's the textbook answer. You can get however much you want. But I know some people will use floss threaders, like those little picks with this much floss in between. Those are fine, and they're actually pretty easy to use if you know what you're doing with them. I usually get my fingers just, kind of where you have this much amount of floss like you would on a floss threader. Really what you want this floss to do is you want to think of it as kind of wrapping around the tooth. And when you place it in between two teeth and you go between the contact areas, you want it to hug kind of the front tooth, and then you kind of wrap it around so that it hugs the tooth behind it. And as it's doing that, you're gonna wrap it around one tooth. You're gonna slightly, gently up and down across the tooth. And then you go on the tooth behind it, up and down, slightly behind that tooth. And then you pop the floss out. So I usually recommend that my patients floss first. I usually like to use the glide floss. And then rinse afterwards, and then brush last. The reason I recommend to go through that sequence is when you're flossing your teeth, you're removing the plaque from in between. And then I recommend you rinse right after. Flush all that stuff around. I use this TheraBreath. It's actually ADA recommended, but there's a lot of good mouth rinses on the market there. And so you've flossed everything from in between the teeth away. You've rinsed everything out, and then you've brushed last. And remember, when you brush your teeth, you're not gonna wanna rinse with water immediately after you brush. If you rinse your teeth immediately afterwards, you don't get the standing effect of that fluoride being in your mouth and making your enamel stronger. So that's the sequence I recommend. You should try it out too.